For my Global Outreach Fellowship, I participated in a public health project with Volunteers Initiative Nepal, a nonprofit organization dedicated to empowering marginalized communities. Nepal is one of the least developed countries in the world, with more than 25% of the country living below the global poverty line. This percentage has increased after the 2015 earthquake that caused damages valuing up to $10 billion, which is about 50% of Nepal's nominal GDP. Kavastali, the town where I was placed to work in, was one of the communities that was significantly affected by this earthquake. Along with another international volunteer and 2 Nepalese volunteers who assisted with translations, we conducted a cardiovascular disease campaign, as non-communicable diseases are relatively new but on the rise in Nepal. By going door to door in the communities, we presented posters on risk factors and prevention to educate and raise awareness on heart disease. We also obtained blood pressure data to assess the prevalence of hypertension in the area. After the first week of work, however, I felt uncertain on the efficiency of my project. The public health campaign was slow, painstaking, and tiresome, as it required hours of hiking on the unrefined mountainous roads of Kavastali. In addition, we were not always met with the most cooperative attitudes. I expressed my concern to my project manager, and he offered to have us volunteer at the local health post. This job required a lot less physical effort, but I realized that I had placed my own satisfaction and comfort above the needs of the community and the volunteer organization. Although we were able to see some interesting medical cases, including cases that we would not normally see in first world countries, our help was not necessarily needed at the clinic, and our experience there was more for our benefit. They needed us most out in the community, where we could offer our perspectives and knowledge by interacting with the local citizens. Returning to the community, we began to take more time to connect with individuals in order to achieve more interest in our cause. We even extended the campaign to the local schools, raising awareness and obtaining participation from the younger generation. I realized that grassroots work may not always result in immediate impact, as many challenges arise when it comes to public health communications. My volunteer experience in Nepal has exposed me to the obstacles of health education, particularly in rural areas, and broadened my mindset as a public health advocate. Most importantly, I learned to acknowledge the fact that change is slow, and in order to allow the change to occur successfully, we must stay active and persistent.